Hello and welcome to yet another episode of Doctors In. In this episode, we'll be discussing about hernia. And we have with us Dr. G Raghu, who have been specialized in gastro and general surgery. Let us welcome him to the program. Welcome, doctor.
Thank you.
First of all, we would like to know more about you.
I am a gastrointestinal as well as a general surgeon practicing at Ernakulam Medical Center, which is situated on the bypass in Cochin. I've been practicing from the year 1994 there, before which I was in UK for a brief spell of about 7 years. Before that I was doing my postgraduate training and also working in some of the surgical departments in and around Cochin.
Okay. Could you explain to a layman what hernia is actually?
Hernia is an abnormal protrusion of a viscous or an internal organ, either externally through the muscle so that a swelling is visible and pain is felt outside, or sometimes internally through one of the natural orifices or holes within the abdomen.
Okay. Where do hernias occur usually?
Oh, in many places. When we talk about the places where hernias occur, I think we need to broadly divide them into external as well as internal hernias.
Okay.
The external or the parietal hernias, the commonest ones are in the groins, which is fairly common, and you call them inguinal and femoral hernias based on the anatomy through which hole they come out.
Okay.
And then you have other forms of hernia, like the kind of hernia that happens after a patient undergoes an operation and the wound doesn't heal well.
Okay.
The skin heals and the abdominal wall beneath that gives way at a later stage, and you have an incisional hernia. These are the common varieties of hernias, external hernias that you come across. Obviously, you have the umbilical hernias, which you see very commonly in children and also in some adults. And apart from that, we have the internal hernias. The internal hernias can occur anywhere within the orifices, natural orifices within the abdomen.
Okay.
These are not visible outside. Okay. But some of them, if not dealt with in time, can have catastrophic consequences.
What is
because they are not visible outside. Okay. The patient only presents with pain. Okay. And we do not distinguish that this is a hernia that's happening inside. It may get stuck in that hole.
Okay.
With the result that the blood vessel is completely cut off to that segment of the bowel which is involved in the hernia, and the bowel becomes dead. So if you do not operate within few hours of a strangulation happening in an internal hernia, then you have a fatal situation on your hands.
Okay. Yes. Can hernias be prevented?
Honestly, I don't think they can.
Okay.
Undue strenuous activity, if thoughtlessly, you see a huge weight and then suddenly lift it up without any precaution or bracing yourself to do that. Maybe such activity, if you avoid such activity, some of the accidental ones can be. But by and large, hernias are not preventable. Okay. These are protrusions which happen through natural orifices, and therefore I don't think they can be really truly prevented.
Okay. What about the causes? What are the causes for hernia?
Most of the hernias, they say, the external ones, including the common inguinal and the femoral hernia, they say that there is a congenital background to this, so that even though the hernia appears at a later stage, maybe in the second or third decade of life, okay, the origin of the hernia would have taken place right after birth, or maybe a little later than that. So very often it is said that most of the hernias are congenital in origin. I'm talking about the indirect inguinal ones. There are the direct ones which occur as a result of, as I said before, undue straining, sometimes due to some nerves being damaged during operations, and sometimes in patients, you see this very often in patients with retention of urine who have urinary outlet obstructions, like aged males who have enlarged prostates. It is very common for hernias to occur. Sometimes the accumulation of fluid within the abdomen can cause direct hernia. So there are many reasons why hernias happen.
Okay. On what age group is more hernia seen?
The common age groups that you see hernias are in the second and third decades of life. I am talking about the external hernias, the ones that we commonly see. The internal hernias can occur at any stage, sometimes in old age. I mean, things like hiatus hernia, for example, is a condition where the esophagus and the stomach herniates into the chest through its natural. The esophagus is the tube which carries food down into the stomach from the mouth.
Okay.
And there is a hole in the diaphragm. The diaphragm is a partition between the chest and the abdomen, and the hole in the diaphragm usually allows the esophagus to come down. Sometimes the stomach goes back through the hole into the chest. This is a hiatus hernia. Okay. That can happen at any age.
Okay.
Yeah.
What are the symptoms of hernia?
Again, as I said before, you're looking at when you commonly say hernia, you're talking about external hernias or the parietal hernias. The first symptom of a hernia is an obvious swelling. Usually, as I said, the commonest one is in the groin, the inguinal or the femoral hernia. So, groin swelling is the first symptom. Some form of discomfort goes along with this, and then later on, a little later, the discomfort becomes pain. And if you don't pay attention to that, obviously the size of the hernia gets bigger and bigger, and in males, it can descend into the scrotum. So many times you have what we call an inguinoscrotal swelling, which is very large and painful. Sometimes if it strangulates, if it gets stuck and doesn't go back, then obviously the pain is constant.
Okay. Are hernias hereditary?
I don't think so. Hernias cannot be called hereditary, but many times you see this condition running in families. That does not mean it's a hereditary condition. All that it means that it's a very common illness, and therefore you see it in many patients, and in some families somehow are prone to get this, but strictly not hereditary like some other diseases. So I don't think this can be termed a hereditary condition.
Okay. Will heavy lifting cause hernia?
It can. Heavy lifting without precautions. You might have seen weightlifters at the athletic meets and various Olympics and others. They take huge precautions not to develop hernias by way of belts and supportive systems and the way they lift. So if there is a methodology for lifting heavy weights, if you do not follow them, then obviously you stand a risk of developing a hernia. Especially without any kind of precaution, without bracing yourself adequately and without proper support. If you suddenly lift a huge weight, then there is a possibility that some muscle fibers can rupture, and these ruptured muscle fibers would be the site for a hernia developing. But usually inguinal hernias are not the result of lifting weights. Hernias can develop due to lifting of heavy weights without precaution.
How does smoking affect hernia?
Not very seriously. I don't think there is a causal relationship between smoking and hernia. Having said that, smoking obviously is not a good thing for any person. And in someone who has a hernia, especially if he is going to undergo an operative repair of this, then if he is a smoker, it complicates matters. That is how it affects hernia, indirectly. Okay. There is no direct causal relationship, as I said earlier. Say, in a smoker, obviously the lung is not in a good condition. And if you repair the hernia, and postoperatively if this guy starts coughing very severely, then obviously there are more chances of the repair falling apart and surgical failure and the hernia recurring. So, smoking, though it's not a good thing, there is nothing to connect development of a hernia with smoking.
Okay. Is surgery necessary for all hernia patients?
Absolutely. I mean, if you want to get rid of a hernia,
Surgery
surgery
is
is the only recourse.
Okay.
Is the only recourse, because this illness, unlike many others, so let's compare an infective disease, which you can treat with antibiotics and kill the bacteria. Once the bacteria are killed, the patient is disease-free. That is not the case with hernias. It's a structural defect. And structural defects can only be dealt with mechanically.
Okay.
Therefore, surgery is absolutely essential to restore the structure. The structure has been badly damaged, and these days, we do not just close and do a repair like what used to happen maybe 20 to 25 years back. Now we do a mesh repair, which means that we put an artificial material across the gap through which the hernia comes out, and then repair the hernia.
Okay. What are the risk factors of doing the surgery?
Like any other operations, there are quite a few risk factors related to the surgical site and the general effects of operation. If you operate on an old age patient, for example, all the risks that are associated with old age, as well as other illnesses which are likely in that age group. Say, for example, if the patient has a cardiac failure or a renal failure or various other complications, obviously you run the risk of those things exacerbating post-operatively and then causing trouble for you. And as far as the hernia site is concerned, it can get infected.
Okay.
Especially with the advent of this mesh repair, you are putting in a foreign body. It is a very biocompatible foreign body, but whatever said and done, it is a foreign body, and therefore no amount of precaution can be called too much. Okay. You take enough precautions to make sure that the site does not get infected. The reason is, once you put in a foreign body and the site gets infected, it's almost impossible to get rid of that infection without removal of the mesh.
Okay.
The mesh becomes a mess.
Okay.
Therefore, this is the most frequent and important complications that surgeons dread. And obviously, whatever good repair you do, wherever it is done, whoever does it, there is always the chance of a hernia repair failing and it coming back, a recurrence, which again is not a pleasant affair.
Okay. What kind of anesthesia is given for hernia patients?
Actually, a hernia repair can be done under any form of anesthesia.
Okay.
Again, we are talking about external. I presume we are talking about external hernias now, which is the common variety. So, in an external hernia, if it's an inguinal hernia, for example, the common one which occurs in males as well as females, if it's an inguinal hernia, you can do it under local anesthesia with a bit of sedation. You can do it under spinal, and you can do it under general anesthesia. If it's an incisional hernia, this is the hernia that I mentioned at the beginning, where after an operation you get the hernia because the wound falls apart beneath the skin. There you can't do it under local anesthesia. You have to put the patient to sleep, or at least a spinal if it's low down. Therefore, there are many forms of anesthetics that can be used, and you have to choose the anesthetic judiciously depending on the patient's physical condition, the site of the hernia, the age of the patient, etc., etc.
Okay. How long does the patient have to be hospitalized?
I forgot to mention at the beginning that the surgical repair can be done in two ways. For most hernias now, the one is the traditional open method, and the second one is the keyhole or the laparoscopic method. In both scenarios these days, the patient, for an inguinal or the commonest one, that is, the patient is discharged on the third or the fourth, sometimes even the second post-operative day.
Why are men more prone to inguinal hernias than women?
This is because of an anatomical issue here. Men have testes and males have testes and females don't. And the connection to the testis by way of the spermatic cord through which the sperm is delivered to the urethra and the blood vessels to the testis. All these structures are carried through what we call a cord.
Okay.
So these structures pass through a natural hole in the abdomen. This is in the groin. And then it traverses what we call the inguinal canal. Okay. And then comes out and passes into this, descends into the scrotum. Therefore, it constitutes a natural defect in males. Mm-hmm. In females, they don't have this.
Okay.
All that they have is a structure called the round ligament, which attaches to the uterus and then comes out of the internal opening of the inguinal canal. And that's it. That's the reason why females get inguinal hernias less frequently compared to males.
Okay. Doctor, lastly, what is the advice that you would like to give to the audience?
Well, I think the advice would be, if you have a hernia which is obvious externally, then please consult your doctor, preferably a surgical doctor, as early as possible, so that he can determine whether this is something that requires an early intervention, and therefore serious problems can be avoided. Thank you.
Doctor, that was nice talking to you. Thanks a lot for being a part of our program.
Thank you very much.
So that was Dr. G Raghu with us. Until we meet next time, this is me, Nana, signing off. Take care.
Sorry.